Hi, I'm Granny Rocks, otherwise known as Beth Green, the founder of theinnerrevolution.org. By the way, there's my Granny Rocks t shirt. And I want to talk to you mostly about healthcare today, but I also want to link it to the unnatural natural disasters that we have been experiencing in 2017. I don't think there are too many people who will deny that global warming has contributed to the fires that we've been suffering from in the West and the terrible hurricanes and flooding that have been devastating parts of the US and the Caribbean. And we wonder what links this with healthcare. Well, both of them are examples of short term thinking that gets us in trouble, where we are not regenerating ourselves or the earth, and how it's going to be more costly in the end. So, very quickly, of course, I can share that our refusal to really commit to using renewable energy has been feeding the fossil fuel burning economy that has contributed dramatically to global warming, climate change, and the disasters we're living through. So instead of spending the money on renewable energy, we're spending the money on cleaning up the disasters. And the amount of suffering that people and wildlife are experiencing because of these disasters, the health issues. I mean, the costs are in the billions, but it's beyond the financial cost. Of course, it's the cost to human beings and wildlife of these painful experiences that are traumatizing emotionally and physically. Now, what does that have to do with healthcare? Well, it's that same short-term thinking that is getting us sick. Now, I mean literally sick. Okay, so we don't do what we need to in renewable energy. We don't put our energy and our money and resources into regenerating the earth, and the earth is showing the stress of it, right? Now, healthcare is exactly the same way. People say, well, healthcare, we can talk about it. It's expensive. It's this, it's that, it's the other. Short-term me-based thinking. Now, I want to talk about healthcare very briefly, but from two perspectives. First is the perspective of the individual. You're a kid, you fall out of a tree, you break a leg, you need healthcare. You're in the prime of your life, you're suddenly struck down by cancer, you need healthcare. You're old, you're fragile, you break a hip, you need healthcare. We all need healthcare, whether we're young, we're, adults, elderly. And why do we need healthcare from a personal perspective? Well, we suffer, we can't go to work, our lives degrade, and so on. But it's so much more than that. I mean, on the social level, we need healthcare in order for the whole society to function. Workers have to be healthy in order to be productive. Not only that, if you have sick people, they push themselves, and then they get too sick, and then they can't work. Or they're not working well, or they bring in a communicable disease and they give it to their fellow workers, and before you know it, the company is wiped out by the flu. It's so obvious that we are all connected. Just as we are when it comes to the environment, we're also all connected when it comes to our health. So you say, well, I don't want undocumented people to have health care. Oh no, we don't want them to have health care. But the child of that undocumented person might have a communicable disease and be sitting next to your child, and your child gets it. So boy, we're really going to get a lot of benefit from that. Or that undocumented worker is in the kitchen of that restaurant washing your dishes and coughing tuberculosis on your food, and how is that for you? Or you're driving down the road in your vehicle and the guy next to you hasn't been able to afford to get rehabilitation from drug addiction, and he's like, hi, and he runs right into you and you're dead. It is so obvious that our society needs people to be healthy. People can't work when they're stressed. People have to take time off from work when their children are ill or when their elders are sick. We are all one. We all need to have health care, among many other things, in order for us to regenerate and to keep going. But that isn't the way this society is organized. This society is organized around profit, and it's organized around short-term goals. In the end, it costs everybody. If we don't have health care for mental, emotional, issues, for addictions, our whole society suffers. You know, the guy who keeps pushing himself with the bad back eventually has to quit. And there goes your FedEx driver. Let's get real, guys. The same short term, me based, profit based thinking that is destroying our planet from an environmental perspective is destroying our own working class and our administrators and our executives, all of whom are too stressed and often are pushing ourselves to work beyond our capacities. And what about mom who doesn't have any kind of health care, or the mom dad, who's staying home to take care of kids who has no health care? What about them when they're too sick to take care of those kids? This costs us all. Let's start thinking. Let's be fighting for a world that meets the needs of people and the environment. TheInnerRevolution.org is supporting the fight for universal health care. Join us in our mobilization to bring together people to fight for a society and economy that meet the needs of people and the earth. Our next meeting is September 30th in many places, but everywhere online, and we're having meetings after that. Check us out. Join us.